Hi, my name is Dr. Dave Robertson. I'd like to talk a little bit about dental practice management. I'm a dental consultant. I have a website, www.dentalmanagementsecrets.com, where I provide information and contact for consulting for dentists. But my consulting has a major difference from any other consulting that is available out there. And that big difference is that not only am I a dentist, but I'm a practicing dentist. Most of the consultants that are out there are not dentists or have given up practicing many years ago, even though a lot of them kind of make out that they still talk about their practice. They make it sound like they're still practicing dentists, but they've given it up long ago. So the real feelings that we have about what it's really like to be a dentist, none of those people really have. But I do. I am practicing just the same as you. And not only am I practicing, but my practice is among the largest in North America. We've got 9 or 10 dentists in there at any one time. We produce over $8 million a year of dentistry. We've got close to 50 support staff supporting all the dentists. And the office obviously is a huge success. But what's even more amazing is I'm not in there running it every day. I own the practice. I'm the 100% owner. There's no partners. And I'm only in there 2 days a week. And that's my dentistry days. So obviously the principles I'm talking about on how to manage a practice must be working if a practice can get to that kind of size, grow that large, and still stay under control with the accounts receivable under control, still having excellent new patient flow, the recall system working well, patient retention, all these things, and everybody getting along. It's all got to be extremely well organized for all that to be able to happen. So I really feel like the things that I'm talking about are real world things. They're not theory, it's what we actually do in our practice. So in order to make all that happen, I've had to learn a lot about practice management. And most of us struggle with practice management, and there's a very good reason for that. All we've ever been taught how to do is drill teeth. We don't know how to manage the practice. No one's ever shown us. When you think about it, we're running a small business. If you wanted to get a degree in commerce or a business degree, that's 4 full years of training. If you wanted to take an MBA, that's 2 more years in addition to that. And yet, not only that, these business grads that come out, if they go and work for a widget company, they don't work 40 hours a week making widgets personally before they get onto the management stuff. You know, when we're doing dentistry, we can't be doing the management. We've got to do all that after hours, all in our spare time. And it's no wonder that, you know, we struggle with these things. Add to that the fact we don't know anything about vision, planning, leasing, competition, contracts, purchasing, tax, marketing, advertising, selling, hiring, firing, training, payroll, even just production. We don't know anything about any of those things other than what we can sort of pick up intuitively, which gets us a certain way along, but we're not experts in any of those things, and it's all things that we need to deal with. It's no wonder that we feel stress when it comes to management. And I didn't even mention the stress that patients put on us. They want us to be perfect and pain-free. I'm not even talking about that because for most dentists, that's the easy part of the job. You know, we can kind of get by on that side because at least we've been trained on that, and we can all get to the point where that part of it works pretty much, you know, it's pretty much under control. But there's another reason why we feel the stress when it comes to managing our practice. It's not just that we don't really know how to do it, it's that we all have this kind of perfectionist mindset. And for myself, it took a long time to realize I had that. I didn't think I was a perfectionist. I thought a perfectionist was somebody that got everything perfect. I didn't realize it's just the opposite. A perfectionist is somebody that no matter what they look at, or especially something that they're doing, it's never good enough. You know, and that kind of expands to the people around them, their staff and others, that their staff are never good enough. Everything that they're looking at from that perfect world model which doesn't exist. So I looked up perfectionist on the internet to get a kind of a definition and a description of it, and here's what I found. A perfectionist is someone who expects much more from himself beyond the normal standards. He usually sets very high standards for himself that he or she can never meet, and so ends up with a degraded self-confidence. Examples of perfectionist standards can be, I'll never make mistakes, everyone should like me, I'll score 100% on all my exams, I should be perfect. Based on that way of thinking, when the perfectionist makes a mistake, he thinks of it as a very shameful situation, and so this causes more damage to his self-confidence. The perfectionist takes into consideration everything except for one thing. He forgot that he is a human being and that human beings usually make mistakes. Now notice they said usually make mistakes. They didn't say might make mistakes or occasionally make mistakes. They say usually. We all usually make mistakes. You know, we always have something that doesn't turn out quite as well as we think, and yet when we're in our office, we feel like everything should be perfect, and when it comes to practice management, that's the area that we're really usually the weakest in. It's even farther from perfection. So, you know, there's that expression, you know, are we having fun yet? A lot of dentists just aren't having any fun. And in fact, I'll bet that every dentist that heard what I just read about, you know, that kind of shameful feeling, I bet every dentist has experienced that. We've all messed up a case that we think we should have done better, it should have been perfect, but we messed it up. It happens to all of us, and we have that awful sick feeling because we care so much, we want it to be perfect, and for some reason it's just not. Well, the thing about practice management is, it is never perfect. A filling can be perfect, even though it's, you know, it's pretty rare. It's certainly close enough that nobody would ever criticize it. But practice management, by the nature of it, it's always getting other people to do all kinds of things, and it just, you know, there's just too many moving parts. It's something that's never finished, and it's something that's always moving, always changing, and there's always somebody in the chain that's going to let you down, and that's why dentists like to do the dentistry. They got nobody else involved. They just do their thing. They're not relying on anyone or anything to do a certain thing. They just take control and do it, and it gets done and they're happy with it. But all the stuff that's happening at the front desk or in ordering or all the stuff around them, somebody else is doing it. We have these high expectations, but yet it's never going to be perfect. And even when you look at your results, there's always something you think, well, this is going well, but now my supplies are getting too high. My staff salaries seem to be getting kind of high that I'm paying out, and yet there's 3 people think they're overdue for raises. And you know, it's kind of one of those things that we just can't control it the way we can control our dentistry, to at least to a far greater extent.